Hey everybody, welcome back. Today we're going to be discussing the axial skeleton, in particular the bones of the skull. Now I'm going to be showing you the different bones and markings on this colored skull. However, on your quiz you will be most likely looking at the white skull. So make sure that you transfer your knowledge from the colored skull to the white skulls. I like to use the colored ones when we first start just because it makes it very clear the differences between the bones. So first I'm going to tell you about the sutures. So there are 5 different sutures. A suture is a joint between two bones. It's a very specific kind of joint, and we find them in the skull between the flat bones. They are immovable, which means that you normally think of a joint as when you move your fingers or your elbow or your leg, but these particular joints are immovable joints. So the one that goes right here is called the coronal suture, and we've already talked about the coronal plane, which separates front from back of the body. This is a suture that runs along the coronal plane, so it makes sense that that's what it's called. It separates the frontal bone from the parietal bones. The sagittal suture goes this direction. And again, we've already talked about a sagittal plane. A sagittal plane separates left from right, and this one separates the right parietal bone from the left parietal bone. At the back of the skull, we have the occipital bone, and there's a suture between it and the two parietal bones. That's called the lambdoid suture or the lambdoidal suture. So that goes right here. And then we have 2 more sutures that are called the squamous sutures, and that's between the temporal bone, which is this yellow part, and the parietal bone. So you have a squamous suture on this side, and you have a squamous suture on this side as well. All right, so we know that this is the frontal bone. It goes from just above the eyes up to the coronal suture. Inside the frontal bone, we actually have a frontal sinus, which is an empty space in the skull that is filled with air. You can't see it on the models, but you do need to know that there are several sinuses, and they are generally named for the bone that they're in. So the sinus that's in the frontal bone is called the frontal sinus. This mustard colored bone is called the temporal bone, and the temporal bone has a number of different markings on it. So a note for you when you're looking at your bone list, the bones themselves are labeled in bold, and underneath the bone there are some indented markings that you need to know. I'm not sure if you can focus on this, but this is the bone and these would be the markings. So not only do you need to know the bones and the markings, you also need to know which marking is on which bone. So the first marking for the temporal bone is the external acoustic meatus, and this is, in here it doesn't go through, but in a real skull this is basically where your ear goes in. The ear canal goes through the temporal bone into the inner ear, which is inside the temporal bone. The mastoid process is this knob-like structure right here, and the mandibular fossa is this sort of hollow space that the jaw is going to articulate with. So when the jaw opens and closes, it moves back and forth in this space that's called the mandibular fossa. We also have something called the styloid process, and you can see that right here. I always think of it sort of thin and projecting. It looks like a stylus, so I think of it as that's the styloid process. And then we have the zygomatic process, which is this part of the bone. So this is the zygomatic process of the temporal bone. The occipital bone, you can see here in green. At the base of the skull, you can see a big hole, and this is called the Foramen Magnum. And the foramen is a word that means hole, and you're going to have foramen a lot, so you might as well learn that foramen means hole. Magnum because it's a really big one, and this is where the spinal cord leaves the skull. On either side of that hole, you can see 2 smooth areas. This is where the skull articulates with the first cervical vertebrae, atlas. These are called the occipital condyles. We have 2 parietal bones at the top of the skull on either side, and remember, in between them you have your sagittal suture Anterior to them, you have your coronal suture, and posterior to them, you have your lamboid suture. The sphenoid bone is kind of a tough bone to see. Actually, you can see it better if I open up the skull and look inside. So here's the front of the skull, here's the back of the skull, here's the foramen magnum. And that sphenoid is this sort of bat-shaped bone inside that's in this lime green color. You can see it. It makes up the back of the orbits, and you can see a little bit of it on either side of the face. But basically, if you think about where this bone is, it's kind of making up the back of the face. In the sphenoid bone, we have 3 different markings. One is called the sella turcica, and that's this little saddle that sits right here. The pituitary gland actually sits in this space. The optic foramen are these 2 holes here. I can stick my probe in here and it'll actually come out. I'm not sure if you can see that. Can you see that? It'll come out into the eye socket. So again, the optic nerves come through these 2 holes from the eyes into the brain. There's also a sinus in the sphenoid bone. You cannot see it on this model, but it's one of the sinuses. So we already talked about the frontal sinus. There's a sphenoidal sinus as well. Also very hard to see in the skull is the ethmoid bone, and it's shown here in yellow. So there's a piece of it here. There's a piece of it on the medial side of the orbits. You can see a small piece of it inside and poking up through the frontal bone. So that's the ethmoid bone. The perpendicular plate of the ethmoid bone forms the top half of the nasal septum. And the cribiform plate is this structure right here, this sort of flat structure. This part that sits up, for some reason it's not on your bone list, but I'm going to put it on there. That's called the crista galli. And it kind of looks like, if you look at it from the edge, it kind of sticks up a little bit like a rooster crest. Looking at the facial bones, the ones that form the bridge of the nose are the nasal bones. There's 2 of them, one on either side. The bone here that forms the lower half of the nasal septum is called the vomer. You can also see a bit of it underneath right here. You can see that's sort of that same muddy greenish color. So it pokes up through the roof of the mouth into the nose. We also have 2 bones shown in pink, one on either side of the nose. Those are the lacrimal bones, and those bones have a canal in them that help drain the eyes when you are tearing or crying. This blue bone at the front of the face is called the zygomatic bone, and the zygomatic bone has one marking on it which is called the temporal process, and that's this part right here. And if you remember, this was the temporal bone, and it had a zygomatic process. So basically we have a zygomatic bone and a temporal bone, and we have 2 processes that are reaching towards each other to sort of shake hands in the middle. And so this one here, this part, is actually called the temporal process of the zygomatic bone. This part here is called the zygomatic process of the temporal bone. And this whole area where it sort of branches out and comes away from the face is called the zygomatic arch, and that makes up part of your cheekbone. The last bone that makes up the face would be this orange bone here, and this is called the maxilla. There's also sinuses within the maxilla. They're called the maxillary sinuses. They're basically on either side of the nose. Those are the ones that frequently people have pain in when they eat something cold or have a sinus infection. And the last bone that we're going to talk about on the front of the face is the palatine bones. There's 2 of them on either side, and they're shown in pink right here. And they're basically making up the rear of the hard palate. If you think about, this is the top, the roof of your mouth. This is the rear of the hard palate. All right, the last bone on here, the last bone on the skull is the only movable bone, and that's going to be the mandible. So this is the mandible here. This is the lower jaw. And on the mandible, we have a couple of markings. We have something called the mandibular condyle, and that is going to articulate with the mandibular fossa that's on the temporal bone. So those two areas articulate with each other. We also have something called the coronoid process, and that's this area right here. And we also have the mental foramen, and that is this area right here. Remember, the chin area is the mental area, so that should be pretty easy to remember. Mental for chin and foramen because it's a hole. So there's two of those, one on either side. And blood vessels and nerves come through those and help to innervate the muscles and skin of the face. Okay, when we talk about the bones of the trunk, we're mostly talking about the ribs and the sternum. So this is the sternum here, and there are three different markings on it. The manubrium kind of looks like the knot on a tie, not a bow tie, but like a regular tie, this shape right here. This is the body, and at the very end is called the xiphoid process. So all three of those parts make up the sternum. Attached to the sternum, coming from the vertebrae around and attaching into the sternum, are the ribs. We have 12 sets of ribs, which means we have 12 ribs on one side and 12 ribs on the other side. Now the first 7 of them, 1, 2, 3, 4, 5, 6, 7, are attached to the ribs via something called the costal cartilages. These are true ribs because they're attached directly to the sternum. So the first 7 ribs are true ribs. The other 5 are what we call false ribs because they are some of them are attached, but they're attached by attaching here to rib number 7, to the cartilage of rib number 7. And the last 2 are floating ribs because they're not attached to the sternum at all. You can see they're kind of hanging out here without being attached at all. So first 7 are true ribs. Last 5 are false ribs, and of those 5, the last 2 of them are what we call the floating ribs. All right, on the back of the skeleton you can see the vertebral column, and we have all of the different vertebrae that fit together and stack together. And there are 4 different regions, actually 5, to the vertebral column. The first 7 are the cervical vertebrae, and you can see they're very, very small and close together. The next 12 are the thoracic vertebrae. So there's, remember, 12 ribs, and so each rib attaches to one of the thoracic vertebrae. At the end, the first one that is not attached to the rib is the start of the lumbar. And there are 5 of those. At the base of the lumbar vertebrae, you have the sacrum, and that's between 4 and 5 fused vertebrae that are fused together. And at the base of that is the coccyx bone. So that's a separate bone. To remember the number of vertebrae for each section, you can think of breakfast, lunch, and dinner. So breakfast at 7 a.m., there are 7 cervical vertebrae. Lunch at noon, there are 12 thoracic vertebrae. And if you are extremely old or extremely tired or extremely hungry, you could have dinner at 5 p.m. and that would be the 5 lumbar vertebrae. So 7, 12, and 5 will help you remember the numbers of vertebrae. Next week we're going to talk about the scapula, so I'm not going to go over that right now, but I would like to show you a close-up of what these vertebrae look like. So here we have the 3 different types of vertebrae that you are responsible for identifying. We have some cervical vertebrae here, we have some thoracic vertebrae here, and we have some lumbar vertebrae here. And what you can see from just looking at these guys, here's a cervical one, so the cervical ones are the thinnest ones, the thoracic ones are a little bit bigger, and the lumbar ones are really, really big. If you look at the body of the vertebrae here, it's much bigger than this body, and the thoracic ones have hardly any body. So a couple of differences between them. If you saw one of these on the bench and I asked you determine which type it was, just by looking at them, there's a couple of things that would point it out. Again, with the lumbar vertebrae, they're really big, and if you look at them from the side, this part here, the spinous process is pointing almost horizontally. Whereas in the thoracic vertebrae, they're smaller, and if you look at the spinous process, it's pointing completely inferiorly. It's pointing almost straight down. I also think when you look at this guy, looks like a giraffe. Look at this guy, looks like a moose. So giraffe, thoracic, moose, lumbar. Cervical vertebrae are a dead giveaway because they have these two little holes on the sides. They all have the middle hole, that's the vertebral foramen, but the thoracic are the only ones that have the little holes on either side in the transverse process. So that's one giveaway. Another giveaway is the spinous process is usually forked like this. We call it a bifid spinous process. You can see the spinous process here, and the spinous process here is just one process. In this one, it would be a little bit more forked, and you can see that in this one right here. There's a little bit of a fork there. Unfortunately, I can't find a cervical vertebrae to show you. Couple of markings on these vertebrae. Again, we've already talked about the spinous process, and we've already talked about the body. They have processes out to the side. That's called the transverse process. We have the vertebral foramen. We have the vertebral notch, and if you have a thoracic vertebrae, and this one doesn't fit perfectly, but if you put them together, you can actually see that that vertebral notch, when there's another vertebrae underneath, makes a hole. And that hole is where the spinal nerves are going to come out of the spine. Again, the spinal column is running, or the spinal cord is running right down through the middle here. Let's see, this part right here is called the lamina, and that's kind of holding the front part to the back part. Remember, this part is anterior, this part is posterior to the body. I think that's the markings that you need to know. Oh, you know what? I think you have superior articular facet is right here. Inferior articular facet is underneath, and that way you can see that the superior articular facets of one vertebrae will articulate with the inferior vertebral facets of the next vertebrae up, and that's how they stack so nicely together. Okay, that's it for axial skeleton.